Tooth hypersensitivity. Sensitivity is a common dental problem that is not caused by disease. There are as many as 38% of the population who regularly suffer from dental pain. Sensitivity occurs when the enamel layer, which is the top layer of your tooth, is removed, and dentin is exposed, which is the second layer. And dentin has thousands of microscopic channels, and once that dentin is exposed, the nerves within the channel may cause a sharp pain. Tooth sensitivity is a self-inflicted problem for most people due to the foods they ingest. These external factors can be controlled with diet, while those who suffer from internal factors are not so fortunate. However, whether you are suffering from internal or external causes of sensitivity, you can minimize hypersensitivity and the effects of acid erosion on the teeth with products such as Sensodyne. Today, acid erosion is a common problem affecting 2 out of 3 individuals, causing hypersensitivity. External forms of sensitivity are almost always due to individual habits. These forms of sensitivity stem from diets or drinks or foods they ingest. Anything that goes into a person's mouth that has a pH of less than 5.5 will cause deterioration, and which could lead to sensitivity. One should avoid ingesting sodas and sports drinks that have a relatively high acidic level. If you insist on drinking or eating things with acidity, you can at least try and minimize that by drinking water, or do so in less than 20 minutes to minimize the length of time that the teeth are subject to the acidity. Due to the high acidic levels, sour candies pose a threat to teeth, although such as these may trigger an enormous salivary gland that can counter the acidic level. And on this diagram, I have water is like a neutral 7. That's kind of what our mouth needs to be like all the time. It needs to be a neutral 7.0. But as you see, I have like root beer is at a 4. 3.2 is Mountain Dew, which I know is a popular thing among people. And Pepsi, which kind of surprised me, is at a 2.4. And battery acid is at a 1. So essentially, you're only a step above if you drink Pepsi from having battery acid in your mouth. And our enamel, which is that top layer of your teeth, it can deteriorate fast with those products entering if we don't wash with water, or at least do so while we're eating a meal. Also, internal sources commonly refer to medical conditions such as acid reflux or GERD. People who experience extreme acid reflux and vomiting are at risk for hypersensitivity. In both cases, the acid from the stomach causes the pH to fall below the appropriate levels and allows for erosion on the teeth. Acid reflux causes rapid erosion to the teeth as it progresses overnight. When a person sleeps and acid reflux occurs, their body is unaware of the event and it does not respond by releasing that salivary gland. This allows time for acid to sit on the teeth and causes extreme damage and erosion. And I just have a few pictures. This top one right up here, these are like the linguals, we call them, or the backs of your teeth. And as you can see, this is pearly white, and then the top picture has like a yellowish hue to it. And that top layer, that white layer, is the enamel. And then after drinking those sodas or acid reflux, you see how the yellow dentin is exposed. And this picture over here has where someone has brushed too hard. We call it abrasion. And you see how that dentin is exposed. And right here as well, if you grind your teeth really bad, if you ever find yourself grinding your teeth at nighttime, you can also expose that yellow dentin, and right there as well. In addition, dental products such as Sensodyne allows people to treat their hypersensitivity and prevents further damage. In addition, the use of softer toothbrushes or proper brushing instruction and the use of toothpaste like Sensodyne helps prevent sensitivity. Sensodyne is recommended by 9 out of 10 dentists. There are 2 different types of Sensodyne toothpaste that contains either potassium nitrate or stannous fluoride. The potassium nitrate helps block the nerves that send the pain signals triggered by certain stimuli. And the Sensodyne Repair and Protect toothpaste contains that stannous fluoride that builds a repairing layer over the tooth that helps protect it from pain. And in this diagram right here, I just have, this is like your top layer of your tooth, and you have these little open dentinal tubules, it's that dentin layer. And they're exposed, and the nerves, these are like your little nerves right here, and it sends those pain signals. After you use Sensodyne, you see how it's protected. It causes like a protective coating over that tooth. In conclusion, hypersensitivity is a common problem for many individuals. External factors can be minimized by your diet, and internal factors are not so easy to control, but by proper medications by your doctor, it can be controlled some. For individuals who are experiencing hypersensitivity, dental products such as Sensodyne are available. All in all, 2 sensitivities such as Sensodyne are available to use to help prevent against sensitivity. By practicing oral care and by using dental products that are available like Sensodyne and visiting the dentist twice a year, you can help protect your teeth from hypersensitivity.